If you are over 60 and have ever felt that sudden, stubborn blockage right at the end where the stool simply refuses to leave, pay close attention right now. What I am about to share is not the usual advice you hear on television or from well-meaning friends. It is a quiet pattern I have watched for years in older patients, and the consequences can be far more serious than most people realize. Many seniors quietly accept this as just normal aging. Yet the longer it continues, the more the body begins to adapt in ways that are anything but normal. When stool repeatedly stalls at the exit, pressure builds inside the rectum. That pressure stretches the delicate nerves that should send clear signals to your brain. Over months and years, those signals grow weaker. Research published in respected medical journals has linked chronic constipation in older adults to measurable changes in the gut-brain axis. The gut produces a large share of the body's serotonin, the chemical that helps regulate both mood and the rhythmic contractions of the bowel. When the lower bowel stays backed up, that chemical balance can shift. Some long-term observational studies have even noted higher rates of cognitive decline and elevated dementia risk among people who struggle with persistent constipation for years. This is not meant to frighten you without reason. It is meant to wake you up to a connection many doctors still overlook in brief office visits. Picture what is happening inside the final few inches of the colon and rectum. Those last centimeters depend on coordinated muscle waves and adequate natural lubrication. After age 60, those waves often slow. Common medications for blood pressure, pain, sleep, or even heartburn can slow them further. At the same time, the thirst signal itself weakens. So many older adults walk around mildly dehydrated without realizing it. Dry stool becomes harder and stickier. The result is a firm plug that sits right at the exit, sometimes for hours. Each time this occurs, the nerves become a little less responsive. Patients tell me they begin to feel the urge less clearly, or they must strain harder. That straining raises blood pressure in the moment, increases the risk of hemorrhoids, small tears, and in some cases can stress an already vulnerable cardiovascular system. Independence itself starts to feel threatened when every bathroom visit becomes a battle. Here is the part that surprises most people who have tried fiber supplements and still feel stuck. A simple, inexpensive teaspoon can change the consistency of that final stool within about 30 minutes for many older adults. I am speaking of pure, high-quality extra virgin olive oil, 1 level teaspoon taken on an empty stomach with a full glass of comfortably warm water. Olive oil coats the stool, softens the outer layer, and gently encourages the lower bowel to contract. It is not a harsh stimulant laxative that leaves you cramping or rushing to the bathroom. It works with the body's own lubrication system. Clinical observations and dietary studies have shown that the monounsaturated fats in olive oil can improve transit time in the distal colon without the aggressive effects that stronger agents often produce in seniors. The warmth of the water helps the oil disperse and may further relax the muscles that control the exit. Of course, this is not a miracle cure for every situation. If you experience sudden severe pain, blood in the stool, unexplained weight loss, fever, or a complete blockage lasting more than a day or two, you must contact your physician without delay. Those signs can point to something that requires immediate professional evaluation. Yet for the very common pattern of stool that repeatedly stalls right at the exit, especially when diet, hydration, and gentle movement have not fully solved it, this 1 teaspoon approach has restored comfort and regularity for many of the older patients I have guided. Some notice the difference the first morning they try it. Others find that using it consistently for several days retrains the bowel's natural rhythm. I want you to pause and ask yourself an honest question. How many times in the past month have you left the bathroom still feeling incomplete or postponed plans because you were worried about discomfort later? That quiet frustration adds up. It steals energy, confidence, and the simple pleasure of feeling at ease in your own body. The good news is that the same nerves that have grown less responsive can often regain sensitivity once the constant pressure is relieved. Clearing the exit regularly gives those nerves a chance to recover their signaling strength. Supporting the gut's chemical environment through better transit may also protect the broader communication pathways that influence mood and, over the long term, cognitive resilience. Do not wait until the problem becomes more entrenched. The earlier you address the blockage pattern, the easier it is to reverse. 1 teaspoon of good olive oil, a glass of warm water, and a few minutes of patience can be the practical starting point. Combine it with the basics you already know: steady fluid intake throughout the day, movement that keeps the abdominal muscles gently active, and meals that include both soluble and insoluble fiber, and many people find the entire system begins to work more smoothly again. I need you to do something for me right now. If this description matches what you or someone you love has experienced, type the word exit in the comments below. I read every comment, and your reply shows me how widespread this quiet problem really is among people over 60. Share this video with any friend or family member who still believes constipation is merely an inconvenience. The longer the nerves remain under repeated pressure, the harder full recovery can become. 1 teaspoon, roughly 30 minutes, and a clearer understanding of the hidden risks. That is the practical step you can take today. Stay curious about what your body is telling you. Your daily comfort, your independence, and even the long-term clarity of your mind may depend on the choices you make starting this week.